Hello, AP students. This is Mrs. Politsky, and I have notes for part 2 of chapter 1, the introduction and history of psychology. So follow along, and here we go. We're going to talk a little bit about the 3 ways of doing psychology. And for the most part, this is kind of talking about experimental psychology, applied psychology, and the teaching of psychology. And when we look at the experimental side of psychology, a lot of times we might call this the research side because they are doing research on basic psychological processes. So a lot of their work is pretty much within a laboratory setting. This could be like a behavioral psychologist, for example. Applied psychology is, for the most part, kind of in the active field of things. These are psychologists who use knowledge derived from the experimental psychologists to solve human problems. And the one thing I do want to emphasize is that these specialties are not limited to the 6 that you see here, but these are the 6 that your textbook includes. So the first one is sometimes known as IO psychology, or the industrial organizational psychologist. And these are people who specialize in the modifying of work environments to maximize productivity and morale. They develop interview and testing procedures to help organizations select new employees. They also develop programs to train and retrain employees, and they do a little bit of specialized market research. The second area is known as sports psychology. These are individuals who work with athletes. They help them maximize their performance. They deal with enhancing motivation and controlling emotions under pressure. They may also help with the planning of practice sessions for these athletes. And you might find them on college campuses. When we talk about elite athletes, so athletes that are professionals or Olympians, many of them work with a sports psychologist so that they can maximize their performance. Number 3, engineering psychologist. These are people who work with the interface between people and equipment. Some of these psychologists design devices to control, like control panels or instrument displays. What they're trying to do is to make them easier or more reliable for human use. Some do some psychological detective work to discover what went wrong in accidents that are attributed to human error. So if we have, for example, a plane crash, these engineering psychologists might go back and look at any human error that could have kind of arise from that situation. And hopefully they could use that data to improve maybe the newer models of aircraft that are going to be coming out so that they're safer for those people who are running them and people who are flying on them. They also may be employed by private industries or the government, often to work with other scientists so that they can make things better. Number 4, school psychologist. School psychologists, for the most part, have expertise in solving problems of teaching and learning. They typically work for a school district. So, for example, for our situation here, school psychologists are provided from the Educational Service Unit in Columbus. And what they will do is they'll come out and they'll diagnose learning or behavioral problems. They might work with the teachers, student, and their parents as far as how to kind of resolve these issues. They spend some time administering and scoring and interpreting psychological tests. For the most part, they do a lot of work with individual educational reports or programs or IEPs to help students so that they can maximize their performance. The 5th one is rehabilitation psychologists. These are individuals who work with physicians, nurses, counselors, social workers to treat patients with both physical and mental disorders. They work with individuals who have a variety of different ailments. They can work with a stroke patient. They could work with a spinal cord injury patient, an alcoholic, a drug um, abused situation, an individual who's gone through an amputation, people who have gone through head trauma. Some work, for the most part, in hospital settings. Others work for social services. But for the most part, they provide a lot of work for um, individuals when we talk about job training or helping people get back to a state of life that they once had prior to an accident. The last area here is the clinical psychologist and also the counseling psychologist. These are people who work with those who have problems with social and emotional adjustment or those who face difficult choice relationships, career issues, or educational issues. About half of all doctoral level psychologists list clinical or counseling psychology as their specialty. So there are a lot of these out there. The clinical psychologist is more likely to have a private practice involving psychological testing and maybe long-term therapy, whereas a counselor is more likely to work for an agency or a school and to spend fewer sessions with each client. Teaching of psychology. These are individuals who are psychologists who enjoy, for the most part, teaching the subject. And they teach either at the high school level or in colleges. And for the most part, if you would happen to take a psychology class, perhaps maybe at the college level, chances are that person who is teaching that class has a degree in psychology. They may also do a little bit of research. A lot of them will be required to write articles in journal entries. All right. So we're going to talk a little bit about the difference between psychiatrist and psychologist. And this is probably going to sound a little repetitive, perhaps maybe from your entry level class. The key here is to know how they differ. So we're going to start with our psychiatrist. This is a medical specialty. It deals with the diagnosis and the treatment of mental disorders. So individuals who are psychiatrists have a degree that is basically the equivalent of an MD, a medical doctoral. So for the most part, as they were going through medical school, this is a specialty that they found very appealing, and rightly so. One of the things that an MD can do that maybe an ordinary psychologist can't is that they can, for the most part, prescribe medication. They can also perform medical procedures. So if an individual is perhaps maybe needing a surgery or such, they can basically be there for that. The other area is the plain old psychologist. These are individuals most likely that have a doctorate, but they treat people with mental disorders, but they put an emphasis on perceptions and learning and testing and developmental issues. The focus is on research and applying sometimes the research that they have. But when we talk about the degree, and we could probably also include another one that's not listed here, but a doctorate in philosophy or the PhD, as you see here. You might also see a doctorate in psychology, which is kind of labeled as PSY.D, which is kind of on the same line as this. Thank you very much.